Hi, I'm Dr. Crystal, and today we're going to be talking about getting better faster. So, if you're seeing this, you've probably gone through some type of ailment, either back pain, neck pain, and you're just trying to get to the core of the solution. You want to get to your end result as fast as you can. So, that's what this presentation is going to be about. So, here at the office, we have me and Dr. Enrico. Put that back in. And so in the office, you'll see myself, Dr. Enrico, Dr. Christine. Dr. Christine does more functional medicine. So she'll focus more on gut health if you've been down with autoimmune issues. And Dr. Enrico does Blair Upper Cervical. And I focus more on pregnancy and pediatrics. You may see some other doctors in our office. We have Dr. Allie currently. And so she'll do more of your sports chiropractic. But all of us work together and we collaborate on care. So that's the difference between our chiropractic office and an office where maybe you've gone to and they've done a quick fix or a quick adjustment and you really just didn't feel like you got results. So that's what sets us apart. Now, our mission is to be an integrative healthcare clinic. So in our office, you'll see we've got other businesses. So another functional medicine office that offers IV and hormones. You'll see nurse practitioners who will also take care of your little ones. They will work with trying to bill your insurance. They're doing women's health. And that's really the goal. We don't want to be just that neck pain doctor or your back pain doctor. We want to be that person or that area where you can go and get answers. And that's something we do. We'll say, hey, we might need an x ray, we might need some blood work. And that's been really great having them in the office. So that way we can send you right over to our nurse practitioners and they can order that blood work for you. You meet with them and they might even say, we need additional blood work. Sometimes we think numbness and tingling may be a sciatica, but it could also be a vitamin deficiency. So, and we'll talk about that too a little bit towards the end with some of the complaints that we've had with patients that they've seen neurologists, they've seen their primary care. No one could really get to the root of the problem. And so when they came to Full Life, they were actually able to get results and feel better. So, chiropractic care, if you're new to this, it is the ability for the body to help heal itself. So, how we do that is through what's called a chiropractic adjustment. And we can do that a couple of different ways. Most people have seen videos where people are getting adjusted, they're hearing popping and cracking. We also have a tool called an activator, which will make the popping sound, but it won't actually apply um, that pressure that you might feel or that crack sound that may make you uncomfortable. But the goal with that is one, to help relieve the tension on the nerve, but two, to allow the connection from the brain to the spinal cord and the nerves throughout the body. A lot of time when we think about the nerves, we're thinking pain, like I burned my finger or something's pinched. It also goes to your organs, such as your bowel and bladder, your heart, your lungs, your thyroid. And so I mentioned that because sometimes we have patients, I'll use constipation, for example. We have patients with constipation. They may not want to tell us what's going on or that that's even an issue, but usually a few weeks into care, they're like, one thing I've noticed besides my pain going away is that now I'm having regular bowel movements. And so that may not be something they wanted to tell me, but they'll tell me now that that issue has started to resolve. And so they may have taken laxatives, stool softeners. They'll even notice it with their kids who are older. And they're just like, I didn't know that this could help. I really just brought them in for hip and low back pain. And low back pain can actually come from being constipated or from being backed up in the bowels. So that's something that we really try to focus on, is that we want to give you the tools, the education, the information to help you to feel better. And that's going to help you get there faster, because the more you know, the more you can apply to your life. Now, with this slide, this is where we talk about if you've ever been impacted by heart disease, cancer, thyroid, especially if it wasn't you, it was a family member, and you saw your family member go through the ringer, and you're like, they've got to go to this doctor and they've got to go to that doctor. When is enough enough? So that's why we're here. We want to help you just educate yourself, understand what's going on. And that's one thing some patients, they'll ask me 20 questions, and I love that. When they don't ask me any questions, I kind of get concerned because I don't want them to just go through the motions. I want them to get better. And that's something that all of our doctors here at Full Life want as well. So, on your second visit, what you'll see is our front desk girls will give you a worksheet, and it will have a graph, and it will have 3 lines for you. And that is going to be for your goals. What are your goals? Sometimes I think it's get them out of pain. And then sometimes for other people, it's I want that exercise. I want to be out of pain. I want to be able to lift my kids or do what it was before marathons, triathlons. I don't want to just get you out of pain, but not get you to that end result. And that end result is going to tell me how long is this going to take? Because that's usually what we want to know. If we sprain something or strain something, we know 4 to 6 weeks. In 4 to 6 weeks, it's healed, but does that mean you can go back to the gym? We usually need to get to some rehabilitative exercises. We need to make sure that you're doing things correctly so that we don't re injure and kind of do this little rotating wheel of I only come in when I'm in pain and we don't actually address the issue. So, as long as we know your goals, we know how we can best assist you. Now, this is where we talk a little bit about the broken system. Myself, like I went to a doctor's appointment and they had been calling me. This actually happened today. I went to the doctor's, they've been calling me. I went in. I thought it was to go over some labs or to see what the next step is. And, they're like, oh, you must be here just for a wellness check. And I was like, well, sure, but what's the next step? Like I want to know, are we doing treatment? Are we doing any diagnostic exams? What's going to happen? And really, I had to kind of push to get those things done. And you really shouldn't have to do that with any of your doctors. They should already have a system set out, like, let's do this based on what's going on within your body. And that's kind of the issue we're seeing with our patients. And so they're coming in here either because there is an issue or they're trying to be preventative with the issues that they've seen in their family. Everyone in the family gets sciatica, or everyone in the family gets a thyroid issue. They want to come in and they kind of want to get there before the problem arises, which is where we want to be. We want to be preventative. We don't want to be the next statistic in our area or population of a certain diagnosis that could potentially harm us. So I love this diagram because it shows us we have a neutral point. We're not sick, but we're also not healthy. And I'd say a lot of us fall in there where, you're like, I'm not really hurt, but maybe I may try chiropractic or maybe I may get a wellness check. Nothing's really going on. Now, the more we don't do, we'll start to see some signs. So those signs could be you're out of breath or you're starting to notice or you're not really quite feeling right. And then they turn into symptoms. And then usually by the time we catch things, it's already turned into a disability or it's taking us to that pre-death. So usually people will say, well, I'm fine. I'm just pre-diabetic. I'm pre-something. They're already heading towards the illness side of this little diagram. Where what we want our patients to know is, okay, we're pre-diabetic. Let's change our diet. Let's work on exercise, whatever we can do. It doesn't have to be aggressive. Want to make you aware of the things you can and can't eat. Make sure you're educated on it. Make sure that you can continue to grow. Because when people do that, I've had family members and patients, they actually come out of that pre-diabetes or even diabetes diagnosis. So that's the whole goal with chiropractic. We're educated in nutrition, in rehab exercises, in blood work, besides just the chiropractic adjustment. So it's really about how much you know and how much you're willing. How much do you want to put into your health to bring yourself to that highest level of wellness? So I love this. You don't get sick, you do sick. So it's not really, everyone in the office could be getting sick, but one person doesn't. Why is that one person not getting sick? And usually it's they're already taking care of themselves. They know they need to rest. They know they need the nutrition. They know basically they should be taking their supplements and their vitamins. So all of those things are what's going to help them to not get sick. Most of us, we let our bodies get stressed out. We are running them down. We're not taking care of it. And so then we do sick. And so this is where behavior matters. Oh, let's see. Okay. So this is where behavior matters. So do we want to be a plateau where we're in that neutral point? Or do we want to kind of let things die down? That's where we start to see those orange and those red arrows. We're going to start to hit a disease state. Or are we going to take the tools that we have, the information that we have access to, and improve our health? So in this next slide, you'll see our health equation. Part of it is your lifestyle. What are you doing at home? How are you eating? Your genetics, and then your environment. Something you might even notice in your environment is the community you live in. Are there community gardens? What's on the shelves in the stores? I don't know if you've looked at some of the stuff in other countries where they actually ban certain foods or certain chemicals. So all of that's going to wrap into what is your health going to be like. Now, what you might see in some of our chiropractic stations or adjusting rooms are the 12 things you need to know, or like the dirty dozen. One is you're designed to be healthy. Your body is smart. And if we continue down that, it just explains why we do what we do and what you need to know for your health to be better. Now, this slide doesn't look the best, but healthy is the normal. Sick and not sick, even though there may be a majority, does not make it normal. One thing that we hear a lot in the office is, oh, I don't really have major complaints, just the normal. And sometimes I have to stop myself and correct myself as a doctor, because what is normal? What is that normal pain you're complaining of? Because I might have my own pain that I associate as normal. And then what you associate as normal is not normal. So is that numbness, tingling? Is that a loss of smell or taste? What is your normal? And is that actually healthy? Or are we actually hitting into a disease state? Now, your body's smart. So sometimes we see fevers as bad. And yes, if they're too high, they are bad. But the fevers in our body is to actually try to help kill the foreign invaders in our body. And that's why we can allow ourselves to sleep things off, to stay hydrated. And then occasionally we may need a certain medication to help us bring that down. We have our white blood cells, we have leukocytes, all of that within our body to help us fight an infection. And that's why they do blood work. They're like, oh, you're fighting an infection. We have our good cholesterol, our bad cholesterol. All of these things are to help maintain homeostasis within our body. So they're not necessarily bad. We just know that there's a negative connotation with that. And so when we talk about the safety pin cycle, if you're like, what is that? When the safety pin is closed, we have what's called, let me see if I can get to it, we'll kind of skip around. It means our body's at ease. And so these slides didn't upload as well as I would have liked them, but it means that we're well adjusted, we're well connected. Our brain can signal to our body the things we need to do. And when it's disconnected, we'll have that open safety pin. And what that tells us is there's a disconnect or a disease happening. So usually I see that disconnect when I'm trying to show an exercise to a patient and they're doing it incorrectly, but they are determined to try and figure it out. And sometimes we need multiple appointments to get that one exercise correct before they can start to do it at home. Because if not, we're going to do it incorrectly. But they're realizing, oh, my brain is disconnected from portions of my body. And if it's disconnected and I can't do this exercise, now they start to understand why we're having issues within our body with trying to do simple tasks, picking up our kids. It's usually the little things, taking out the trash, doing the dishes, picking up the kids. So like, I didn't do anything crazy. There were no traumas. Why am I like this? And usually it's the last thing to kind of break the camel's back. It's not the first thing, it's that last thing. And I'll go back a couple slides here. So your spine is a suit of armor. And a lot of people are like, why do I need a chiropractor? I can have my kids jump on my back. I can have someone else bear hug me. And we actually forget it's not about that popping sound. That popping sound, some people associate with relief, but then 2 seconds later, they're asking for someone to do it again. And the reason is because we have our spinal cord there. That's a vital um, portion of our body. You hear of actors or people who have had spinal injuries and they can actually injure themselves. So this is why we recommend you don't have anyone crack your back unless it's a chiropractor because they're going to do a chiropractic adjustment. They were trained, they know what they're doing, they studied neurology, they studied physiology, they did gross anatomy. These are all things that are very vital to your whole body. So we don't want just anyone pushing on our back and injuring our spinal nerves. Now, with chiropractic, we know life is stressful. And sometimes people, like I said, they want to know what causes those issues. And some of it is our thoughts. So we get stressed out at work, our family, someone gets sick. All of that's going to put more stress on the body. Now you add in toxins, and toxins can be the foods we eat. They have chemicals in it. It can be the chemicals in our house. Now our body is stressed on a physiological issue. And then traumas, again, that can be physical, that can be psychological. We don't realize all of the things that our body gets bombarded with and how that body has to handle it. And at some point, your body's going to say, I need a break from all of these things. And if we don't give it that break and rest, now we're heading into a sickness or a disease. So a subluxation, that's when we talk about misalignment in the spine. So a subluxation can cause dysfunction, and that dysfunction can be biomechanical, it can be physiological, it can be emotional. So sometimes patients overhear another patient, we might have a patient cry, and it's actually not because they were hurt, it's because they're having an emotional release. And that doesn't happen too often, but it can when we're trying to bury down what's really been bothering us. And that goes back to those thoughts and those traumas. So, how would you know if you had a subluxation? Usually, you can feel discomfort. You're like, something just doesn't feel right. And sometimes you'll notice it even in your children. So, people think chiropractic is a lot to do with neck and back pain or adults. And children can have it, they just don't know what pain is. If you were to ask your child, like, do you have pain? They might say yes, they might say no, but if you ask them where, that's where you can determine, like, they don't quite understand. So you can see that for children as restlessness, as issues with potty training, with reflux, with colic, if we're talking about babies. You'll start to notice it in your children. And usually our parents have hit a dead end with their medical providers because the medical providers say, well, down our lane of knowledge, everything's fine. And the next provider, same thing, everything's fine. And it's usually we're the last stop along the way because we've tried everything else that they're like, please take a look at my kid. Or even for the adults, please take a look at me. My doctors can't figure out what's going on, but I know there's an issue. So, what should you do if you have a subluxation? And this is where chiropractic comes in. This is where we are trained to look at the body. We have neurological scans that can look at heart rate, your thermal scans, they look at your muscles. It breaks down just anatomically what's going on, but also looking at physiologically, emotionally, how your body's handling the stress. And it actually gives you a score on the health scale, 100 being, 100 an A, to all the way down to 0. And most people, when they come in, they're going to be in our red area because they've waited too long or they've tried everything else and now they're here. So, with our office, we have what's called the three-legged stool. We have the adjustments. So, those are going to be specific adjustments to the spinal column. And that's going to be either found through palpation, the x-rays, and the scans. So all three of those are key indicators as to what's going on, plus how you feel. That's going to tell us each time, are you getting better? And if so, great. If so, but not really, like other things are popping up, we really need to dig a little bit deeper because sometimes the main pain may just be covering up what the true issue was. Then we have our corrective exercises. And like I said, I don't send my patients out to do them at home unless I know they can do it correctly. So that's also including breaking bad habits. And we have a lot of patients who are physically active, and I don't tell them to stop. I want them to be physically active, but sometimes I make them do those exercises that they do outside the office in the office because I want to make sure that they're doing it correctly, that they're activating the correct muscles that need to be activated during those exercises. Now, a lot of times what we're thinking as the patient is I need me and I need that thing and I need it now. So it's trying to figure out how those three things, how can we get them all where you need them to be, and also in a good time manner, because I know we've got time, we've got things, but it all depends on where you want to be on that health chart that we talked about. Do we want to be complacent, neutral, or do we want to get better, or do we just want to leave it where it's at and see what happens? So this is one patient that I want to talk about. So this is where we talk about primary cares, specialists. This patient came in with burning in her hands. And so when she came in with the burning in her hands, I immediately was like, have you had any blood work? Because that can be a deficiency in our B vitamins. And then from there, all her blood work came back. That was part of why she came in. Her primary was like, oh, let's go to the neurologist because this is a neuro issue if it's not vitamins. And she was like, I have these appointments with the neurology. I don't know what's going to happen. And I advised her, keep those appointments. Let's take some x-rays. We might need to do an MRI. Um, and she's like, most patients, if they've hit dead ends, they're like, am I making this up? And no, she wasn't. With chiropractic adjustments and also a decompression table, because I saw that there was some compression in her spine and the neck, we were able to alleviate these symptoms. I think after they alleviated, it happened one more time. We went right back on decompression one more time. She hasn't had it since. So now what she does is she continues to come in. And when she comes in, she's mainly just doing it for maintenance now. We're trying to stay healthy. We're not trying to fall below that line because she already knows when I get that tingling, something's happening. I don't like it. I can't take care of my kids. I don't want to hit that road again. I want to stay where I'm at. So I've heard from other patients where they're like, I heard if I do chiropractic care, I have to do it for the rest of my life. And that's not necessarily you have to do. Patients come and go all the time. I don't hold you here. The thing is, they want to come back in. They'll even say, I get to come back in. And that's because they've already seen the change in their lives and they've seen that increased range of motion or that increase in exercise or taking care of their family. The things that debilitated them before no longer occur. So that's what keeps them coming in. We don't hold anyone hostage here. We love seeing them, and we actually love sending them birthday cards and seeing the new additions in their family. And when we miss them, we actually check in on them as like family. We're like, how are they doing? It's okay if they're not coming in. We just want to make sure that they're doing well and that we've met all of their needs. Now, this other patient, he had back pain and he was 315 pounds. He knew he had to do something. He was getting adjusted by all the doctors in the office. He changed his whole work life, chairs, desk, everything. He realized he had a stressful life and he started to work on that. He also did our chiropractic program here and lost over 130 pounds. And he is now 189 pounds. And the thing with him, it was so interesting because he actually sees Dr. Enrico more. So when he did the chiropractic program the first time, I was like, oh, you lost some weight. Like you recognize it after 20, 30 pounds has been lost. The next time he did it, he kept just shredding the pounds off. And if I just happen to be at the front desk, I'm like, who's this guy waiting? And he's like, oh, you're just trying to like flatter me. And I really wasn't. I didn't recognize him because of how much weight he lost. It was so significant that every time I'm like, oh my gosh, it's you. Like, I haven't seen you. I don't see you on a regular basis. You see our other doctor. You look great. And he has kept it off. He's maintained it. He became easier to adjust. He feels better. And these are just things that we're just out here in the community trying to help others. So as you're going through your wellness and getting back to that wellness point, we want you to think about the other people in your family who are struggling. And sometimes, you can't always make the horse drink from the water, but you can kind of give them the information, and it might take them some time, but we're here in the community just trying to help out all the families, all the people. We don't want people suffering with neck and back pain. That should be a thing of the past. We want them to be able to get the care they need, whether that, like I said earlier, blood work, imaging, getting to the right providers. We aren't trying to just keep patients. We want to make sure that they're in the right spot. And sometimes they're not, and sometimes we're not the right area for them. But if we can, we want to help them get better. We want to help you get better. And so that's the whole point of this whole presentation, is helping you get there. So I hope this helped. I hope you think about, what are your goals? Do we want to get healthy? Do we want to get better? Do we want to get stronger? And if so, what changes do you need to make? And what can I do to also help you? Is that exercise? Is that diet plans? Is that talking about nutrition and supplements? Is that seeing another provider? So these are all things that we want you to think about and just look back at. So I hope you enjoyed this presentation. It was so nice to give it to you, and I hope you have a good evening.